Hello, my name is Justin Martinez. I'll be doing my HEENT and mental health evaluation. To the right of me, I have my otoscope and ophthalmoscope. It's like a two-pack, so I'll be kind of messing with the heads there. Snellen chart, my pocket Snellen chart, and my tuning fork. Lastly, the mental health questionnaire, but that'll be at the end. Good morning, my name is Justin. I'll be your provider for today. I'll be doing an HEENT evaluation on you. That basically means I'm just going to be inspecting your head, and then I'll do a mental health questionnaire really quick, nothing too crazy. The HEENT exam does require me to kind of palpate on you, which means like touch. Are you okay with that?
Yeah.
If anything does make you feel a little bit uncomfortable, you let me know. We'll stop right there, okay? Sounds good. So the first thing I want to do with the HEENT is I'm going to go ahead and start like around like your hair area. I'm going to inspect your hair. Is it okay if I touch your hair? Yeah, I'm going to look around. I'm going to look under it and all that good stuff, okay? So first things first, go ahead and look straight at me. Okay, perfect. I'm going to grab my Snellen chart right here. Okay, face is symmetrical, no drooping on either side. All is good there. I'm gonna go ahead and look at your hair really quick. You're gonna feel me touching a little bit. If anything, again, is bothering you, you let me know. So scalp looks clean, no signs of pediculosis, even though that's typically in adolescents and children. The one thing that I am gonna look for here is alopecia, which is like hair loss. Have you noticed any hair loss?
No.
No? Well, you certainly have a ton of hair here. Okay, go ahead and look out for me. The next thing I want to go ahead and do is I'm just gonna look at your face overall. There looks to be no broken skin or anything like that. You don't have any like acne scars or anything, so it looks good. May I pull your hair back behind your ear here to get a full look at your face? Perfect. Ears look symmetrical. Go ahead and look straight towards me. Yeah, ears look symmetrical. No deviation, no nasal deviation. Everything looks good there. Okay. The next thing I'm going to do is the palpating part. This part, I'm going to kind of feel your thyroid, trachea, and what we call the lymph nodes, okay? The first set of lymph nodes I'm going to go ahead and take a look at is going to be if you have anything, any uncomfortableness, please let me know, okay? So I'm just going to run my fingers back here. They're going to actually be in the back. No noted inflammation, no nodules, nothing like that here. Go ahead and look up for me. So as I'm palpating, I'm just going to keep going through here. Perfect. No noted nodules, no inflammation. Looks good. Tell me if I do it a little bit too hard, okay? Okay, everything feels soft. No noted inflammation. Go ahead and look up. So what I'm feeling for now is kind of like your trachea, yeah? Thyroid. May I go behind you really quick? So go ahead and do that same thing, but now, yeah, no noted deviation of the trachea. Looks midline. Now do me a favor, swallow. You don't have to swallow looking up, like just like that. Very good. Okay. Noted that the trachea did go up symmetrically. Everything moved properly. Once again, no noted nodules, nothing to report there. Okay, the next thing I'll go ahead and do is I'm gonna check your eyes. Okay, so let me go ahead and set this up really quick. Right here, I'm just gonna, oh goodness, this is really hard to get out. And with the Snellen chart. So the first thing I'm gonna do, you have your glasses on. Perfect. Perfect. Typically with our glasses, we're gonna have the 20/20 vision. That's typically what corrected lenses are for. Okay, so what I'm gonna do here is, just making sure that it's recording. What I'm gonna do here is, I'll have you actually, since you have corrective lenses, I'll have you start here and go ahead and read that best you can.
DHJBS.
Yeah. How about this next one? Last one?
LTFPH.
Perfect. Go ahead and cover your right eye. Yeah. Tell me, go ahead and tell me, we'll start at this line.
OLCF.
Go ahead and skip to this line.
CFDHJ.
And go ahead and this last one. No, that's okay. Perfect. Go ahead and cover your other eye. Go ahead and start at this line.
DHJBS.
Yeah. Let's skip to this one.
LT. LTEFA.
Cool. Perfect. Who is your eye doctor, lady? Just kidding. Alright, perfect. So we'll go ahead and I'm gonna inspect your eyes. Is it okay if I take off your glasses? Oh, you can take off your glasses. Do I need anything from here right now? No. Just the pen line. So go ahead and look straight at me. I'm just gonna see if your pupils dilate, okay? You're just gonna see a quick line. Beautiful. Very good. So pupils are equal, round, reactive to light accommodation. Both pupils measured at a 2. Perfect. I'm just gonna look at your eyes really quick. Just go ahead and look towards me. So eyes do look a little bit pink, but no noted inflammation or redness. Do you get a lot of teary discharge?
Mm-hmm.
Yeah, you have a little bit of dry eye here and there. Yeah, that can happen. Do you have allergies?
Yeah.
That's typically where it comes from. Now what I'm gonna do is I'm just gonna pull your eyelids down, like kind of like this, right? Just to kind of see the conjunctiva and see what color it is, okay? Beautiful, nice and pink. Okay, go ahead and look at my fingers really quick. Yeah? Either one. Now look at the other one. Beautiful. It looks like both eyes are symmetrical. They're both following each other. I'm going to cover this eye. Look here. Look. Move your chin up a little bit. Let me see this. Now look at this finger. Look at this finger. Very awesome. Very minimal extraocular muscle movements. My goodness, it's a little bit hot. Looks like there is no swelling around the eyes. No tears at this time. But what I'm going to go ahead and do is I'm actually going to inspect your eyes with the instrument, okay?
Mm-hmm.
There is a little bit of light that comes with the instrument, but what I'm gonna be looking at is basically like your, like the disc, the cup, retina, and like the retina vessels that okay? Really straightforward. Does that hurt? Like the light? It's just a little bright. Nice. Very good. So no noted problems there. No, the vessels looked healthy. There was no like inflammation of the vessels that I had noted. Okay. Any questions on that as far as that goes? No? I'm also gonna check this really quick. I just kind of want to see if there's any. Go ahead and close your eyes. So what I'm gonna do is I'm gonna put pressure on one side and kind of feel it on the other side. Okay, good. Have you ever had a history of like styes or anything?
Mm-mm.
They're basically like pimples inside the eye, nothing like that. Sounds good. Okie dokie. Let's go ahead and move on to the next part, which is gonna probably be, we can either do ears. We can do ears next. I'll just go ahead and get this next instrument ready to go here. Now, as far as your ears, are you having any hearing loss problems or anything like that?
No, I just get another ear infection.
You get some ear infections. Okay. Well, what we can do is we can go ahead and take a look. I'm going to use this instrument to kind of look into your ear. I'll let you know if there's any inflammation that I see. But first I'm going to inspect your ear. So I'll have you turn this way really quick in this chair. So ear, from the outside, no noted deformities. Everything seems to be within normal limits as far as this goes. Any tenderness? No? Looks good. No noted tenderness in the outer part of the ear. I'll go ahead and inspect the inner part of the ear. Let me go ahead and get it. Alright, perfect. No cucuys in there? Go ahead and move this way. Let's see here. Hopefully no pop-ups. I saw earwax. Nothing crazy. I know. I was just joking. But looks good. The next thing I'm gonna do, my goodness, I'm so sorry about the temperature in here, is the tuning fork. So this tuning fork is basically just gonna tell us about like how your hearing is. And then we're gonna do two tests, okay? So the first test is the Weber test, okay? It's gonna it's gonna test like unilateral hearing, so how you're hearing on both ears, okay? This one's pretty easy. All I'm gonna do is this number, bam. Did you hear the tuning fork in either ear more?
They sound the same.
They sound the same? That's exactly what we want. One more time. How about now?
Same.
They sound the same? Perfect. That's exactly what we wanted. The next one is, I'm gonna put it right here on the mastoid process, okay? What it's going to do is going to test bone conduction versus air conduction. You know what that means? It's just fancy words for the sound. But nevertheless, all I'm going to do is tap it. I'll put it on the bone. You tell me when you stop hearing it. Then I'm going to move it to your ear. And then you tell me which one was a little bit more clear, which one lasted a little longer. Okay? Tell me when you stop hearing.
No. That one's clear?
Is it still going?
Yeah.
No, it's not. You see, that is exactly what we wanted. The ear one, so you're basically like, you're good as far as like audio loss, essentially you should hear it technically twice as long in one ear, and the bone one shouldn't last as long. But let's go ahead and try this other one. Let me know how this one goes.
No. No.
Perfect. So it looks like that that did last twice as long. The next thing we're gonna go ahead and do is just the whisper test. Can I just have you turn? Okay. I'm gonna whisper numbers. You're gonna say them back to me, okay?
7, 22, 47,
Perfect.
60, 71, 84.
Perfect. Right on. You passed that. Go ahead and turn right back around. Okay. Sounds good. So when I looked into your ear, your tympanic membrane was good. I didn't see any inflammations. You don't have an ear infection right now, do you? Okay, perfect. It doesn't really seem like you had any pain as far as like the thing goes in. Typically when we have an ear infection, it'll be pretty sensitive to even put that thing just a little bit in. But I think we're good there. We can go ahead and move into our next segment, which is actually going to use the same instrument, but what we're going to do here is we're going to go into the nose, okay? So, why? Did you have a little bit of boogers in there?
Yeah, really dry.
Really dryness?
Yeah.
Okay, that sounds good. So nothing too crazy with the nose. All I'm going to check is for nasal deviation, which as it is, looking at you straight forward, no septum deviation, so that's good. Nothing there. What I'm going to do is actually, let me grab this instrument. I cleaned it, okay? So what I'm going to do is I'm going to shine this light. I'm going to shine this light like through the skin, and what it should do is light up the other side. This is going to confirm that there is no, beautiful, no hemorrhaging and nothing like blocking that part. So we see the light perfectly. Okay, I'm going to change this little nozzle out for another one. And what I'm going to do is I'm going to go ahead and just lick up your nose. Okay. So no nasal obstructions noted. Patient does have a left nose piercing. No obstructions there. Ooh, that's a big one. Just kidding. Looks good. And nothing too crazy, okay? Do you notice any problems with your nose? Maybe just allergies?
Yeah.
Yeah, because of the rain.
Mm-hmm.
I'm gonna feel your sinuses. We'll go ahead and rule out any sinus pressure, okay? We'll do the frontal and maximal. The frontal's gonna be here. I'm just gonna palpate really quick, so you're just gonna feel me knocking, okay? Tell me if you feel any pain.
No.
Any pain? No pain from the reported by the patient, and on top of that, There's no noted inflammation on my end. I'm gonna lift your glasses just a little bit. There we go. Any pain or anything? No? How about this? Just kidding. Perfect. So that looks good. No noted inflammation, no pain. The pain is pretty sudden. So if you did have pain, I mean, honestly, it would have been pretty apparent. I've tapped on some patients' faces, and when I'm tapping, they're like really fast. So that's good. No problems there. We'll go ahead and move on to the last part of the exam, which is the mouth and the pharynx. Okay, I already did like your, let me just change this little nozzle out. I already did your, what was it? Your thyroid and your throat. So all I'm gonna do is look at your lips, which no cyanosis, no bluing. What I'm gonna do is I'm gonna go ahead and like smile. Looks good. Go ahead and open your mouth. Oh, very good. Say ah. Looks good. No ulcers noted from the patient. No candida, no fungal infections. Mouth is pink. Tongue. Go ahead and stick your tongue out for me. Say ah. Keep going. Beautiful. So tonsils look to be properly sized. There's no inflammation back there. No inflammation in the back of the throat. Tongue is symmetrical, and when patient said ah, patient was able to follow directions as far as that goes. The hard palate is pink, no noted like inflammation there. The soft palate is also pink, no noted redness, nothing of that nature. You have any gum problems or anything like that? Gingivitis, anything like that?
No.
No? Okay, perfect. So we already checked out kind of like your tongue and whatnot. Soft palate was good. Now, lastly, I think that's about it. Can I just check your vulva one more time? Yeah. So go ahead and stick your tongue out as far as you can, and then say ah for me, like nice and big, okay? Perfect. So your vulva, pink, no noted redness back there. It is midline, no shifting, no deviation from the normal. Okay? Now we're just gonna do the mental health examination and we are done. Easy peasy?
Yeah.
Perfect. First off, let me just ask you, any anxiety today?
No.
No? Any depression? Thoughts of hurting yourself?
No.
How about thoughts of hurting others?
No.
No? Took a little bit long there, lady. Just kidding. But, any thoughts of suicide? Do you ever think about suicide?
No.
No? Have you ever made plans to do anything like that?
No.
No? Good. That sounds good. Let's see. So I'm just going to ask you a quick questionnaire. We'll go ahead and get the total scores and we'll go from there. Okay? So, this is a questionnaire about depression. So, have you been showing little interest or pleasure in doing things?
No.
Not at all?
No.
Perfect. Have you been feeling down or depressed?
No.
No? Trouble falling asleep or staying asleep?
No.
Or sleeping too much?
No.
No? Feeling tired, little energy, things like that?
No.
No? How about poor appetite or overeating?
No.
No? Perfect. Feeling bad about yourself, that you're like a failure or anything like that, you haven't progressed long enough, things like that?
No.
Trouble concentrating on things?
Mm-mm.
You know, maybe something that you're normally concentrated on, you always have something on the back of your mind? No? Moving slow or speaking slow, I'm going to mark that a no because you are talking to me coherently. You're not really having any problems processing.
Mm-hmm.
Thoughts that you would It would be better if you were gone, better if you were dead, not here, things like that. No? Well, I must say you failed. Just kidding. You passed. It's cool. Your total score was a 0. You didn't really have anything going on there. But if you did, please do come back. Things change from one day to the next. You let us know how we can help you. And we're always here to talk. Okay? Any anxiety? So let's go over anxiety. Anxiety's a pretty big thing in our community as far as Hispanics go. You tell me how you're feeling about this, okay? Do you ever feel nervous or on edge?
Sometimes I am nervous.
Yeah. One day, more than half the days. How many days would you say roughly?
Maybe 2 days out of the week.
2 days out of the week? Okay. How about not being able to stop or control the worrying?
No, I can. I have my ways.
You have your ways?
To
Okay.
cope.
How do you typically cope?
Play video games.
Okay, cool. Hobbies. Yeah, definitely. Do you have a strong support system?
Yeah.
Perfect. That sounds good. How about worrying too much? Do you feel like you worry too much?
No, just a normal.
Just a normal amount, just like anybody else, probably. Okay, that sounds good. How about trouble relaxing?
No, I can relax.
You can relax just fine. When you play video games, you're not really thinking about anything else? Fantastic. How about being restless? Maybe hard to sit still, things like that?
No.
No? You're better than me, girl. Becoming easily annoyed or irritable? No? That sounds good. And then lastly, feeling afraid. Maybe that something awful's gonna happen. How about that?
No, just when I watch the news.
You know what? That's all of us. With everything that's going on, yeah, it's kind of hard not to think about all that stuff. You did rate yourself at a minimal anxiety. That's a 0 out of 4. That's pretty low overall. But that's good. That's good that you feel that way. I'm glad that we were able to do that. This is the last part of the exam, okay? So there's this little thing that I'm going to ask you to do. I'm going to ask you to remember 3 words, okay? We'll go ahead and use this version, okay? We're going to use captain, garden, and picture. You repeat them back to me?
Captain, guardian, picture.
Garden.
Garden, picture.
Garden, picture, yeah. So one more time?
Captain, garden, picture.
Okay. So what I'm going to have you do is I'm going to have you draw a clock. You're going to put the 11, you're going to do 10 minutes past 11. Okay? Now when you draw this clock, go ahead and fill it in. There's already a circle in for you. Lady, you didn't even fill out these. You really have to do it.
What do you mean?
Yeah. How you typically would.
More?
Yeah, like the whole clock, yeah. Now 10 minutes past 11?
10 minutes past 11.
Yeah. Perfect. Looks good. You remember the 3 words?
Captain, garden, picture.
Captain Garden Picture. You were perfect. Captain Garden Picture. Okie dokie. That's going to be all for today. I want to thank you so much for your time. Thank you so much for letting me do my assessment here with you. Do you have any questions or anything like that?
No.
No? Well, it was so good to meet you. Thank you once again for taking the time to do this, okay?
Thank
You have a wonderful day, okay?
You too.